Hello. Before we get started, I'd like to ask you this quick question. Do your cultural traditions actively promote physical activity? Well, as a Nigerian American that is finishing his kinesiology degree at the University of Maryland College Park, this question has been on my mind lately. Why? Because this is my life story. You see, I went to boarding school in Nigeria for 2 years. When I came back to the US, my friends and I started a non-profit cultural organization called Potch Africa, where we teach Baltimore youth about African traditions through traditional dancing, language classes, and dramas. I was the dance instructor for this organization, and my experience as a dance instructor exposed me to the essential skills of exercise instruction and programming as I led my dancers through movement breakdowns and created progressive conditioning programs for dance fitness. Growing in passion for these skills intrigued me to the career of physical therapy. As someone that committed to Afrobeat dancing in college, I discovered the resemblance the career of physical therapy had with my background knowledge in dance movement and in dance acclimatization. Being a dance instructor meant the responsibility of preventing and caring for my dancers' injuries. I remember a situation where one of my female dancers suffered a minor knee strain during one of our practices. We were 2 weeks away from a major competition and had no time to find a replacement. So, I applied my background knowledge in kinesiology to assess her injury, develop a mock plan of care, and apply some quad strengthening exercises to her. She expressed deep gratitude towards me as she felt a lot better after this process. It was applicable moments like these that reinforced my decision to pursue a career in physical therapy. I believe that diversity in healthcare is the valuing of patients' race, ethnicity, gender, sex, religion, disability status, and other components in order to ensure equitable treatment. Diverse representation in healthcare is crucial as it gives a sense of comfort to patients who come from similar backgrounds. I myself have experienced the vitality of diverse representation in the healthcare realm. One time, one of my patients was racially stereotyped. This patient is an African American male who suffered nerve pain in his lower extremities. Now, the physical therapist that I shadowed under as a rehab tech in the hospital deduced that this patient was a drug addict that was just here for some more doses after looking at his case file and seeing where he was from. When we went to the patient for an evaluation of his injury, he started to explain the backstory of how the injury developed and some social factors that came into play with it. Now, the physical therapist expressed some signs of disinterest as she dismissed his story multiple times. This patient became increasingly agitated with her and expressed signs of disinterest in continuing the appointment. When the PT stepped out to go speak with his nurse, I stood over there and I continued to confide in him and also express signs of empathy and comfort in him as well, as he continued to confide in me with his story and also with his injury. He expressed that he felt really safe with me as a fellow Black man, and that he felt that he wasn't alone in his pain and that he felt heard when I was there. It is in situations like these that I am reminded of the importance of diverse representation in our healthcare professions and how culturally competent physical therapists can provide a safe space for patients not only to confide in them for medical help, but also social help as well. Social justice is essential to healthcare because access to quality medical services should not be restricted to a patient because of their race, background, or economic status. Yet, I have experienced how patients have been restricted from these opportunities due to systemic barriers. One common issue I've come across is insurance companies neglecting their patients from receiving proper rehabilitation care, especially post-surgery. I've come across patients with conditions that need at least 12 to 13 weeks of rehab treatment. However, these companies only give them 5 to 6 weeks of rehab care. When health professionals request for more time from these companies, they are either denied or left hanging for a long period of time. This leaves patients vulnerable as it increases the likelihood of them developing a secondary injury. I believe it is our responsibility as health professionals to advocate for these patients to these companies and other financial organizations that can help supply resources and strategies for these patients. As a future physical therapist, I aspire to establish a nonprofit organization with the goal to raise funds for my local community to meet the full demands and duration of their rehabilitation. I also aspire to promote other organizations with a similar agenda. One of the most concerning barriers of healthcare delivery to me is medical deserts. I come from Baltimore County, but I work in Baltimore City. If you know anything about Baltimore in general, you know that there are zoning inequalities when it comes to the medical services provided to the people in the community. I can recall a time when I worked for a physical therapy outpatient business that had many clinics within the Baltimore County region. Now, the clinics within the Baltimore County region had quality service, many equipment, as well as different physical therapists that were willing to help out patients with whatever injury they had. However, this same business only had 1 to 2 clinics within the Baltimore City region, especially one clinic in the Frankfurt area, and that one clinic was struggling to stay alive. When I was stationed at the Frankfurt area to work as a tech, I realized the clinic had poor equipment, services, and staff as only one physical therapist agreed to work in that area. While working there, I realized that there were environmental factors such as the socioeconomic status of the community that discouraged the company from investing time, energy, and funds into this clinic, which is ironic because there was a higher demand of rehab care from the residents in the community and a higher rate of injuries and accidents. As medical deserts continue to populate some zones of Baltimore City, I love the idea of mobile physical therapy, as this tackles this issue by bringing the qualified medical professional along with all the quality rehab equipment to the disadvantaged individual. This way, we can continue to promote more access to quality medical services within the Baltimore region. My passion for physical therapy keeps growing as I face new challenges in the rehab space. Challenges that I feel uniquely prepared to address with my background, experiences, and ideas. I'm especially interested in expanding mobile physical therapy services, applying my career knowledge into the dance community, and eventually establishing a nonprofit organization that can help fund patients' rehab care when insurances or other resources fall short. As someone with a diverse and unique cultural and personal background, I am excited about the opportunity to contribute to Harrisburg University's diverse learning environment and achieve these goals as a future physical therapist. Thank you.